Friends, welcome to CNS Viewpoint. Today we're going to talk about gene sequencing. As you might have heard about the Omicron, the new variant of the coronavirus. There were questions which we received about what is the difference between different COVID tests, etc. So we thought, let us talk about gene sequencing. So, do you know, like in November in Karnataka, there were about 139 samples which were sent for gene sequencing. WHO recommends at least 5% of all the coronavirus samples which are collected should be sent. 5% of them should be sent for gene sequencing. So that public health officials are well aware of if there are mutations happening in the population as the virus is circulating, and what are those mutations, what it might mean for public health program, like in terms of, is the virus mutating, and if it is mutating, then is it still detectable using the diagnostics which is being used? Is it more infectious, less infectious? Do we need more? What about treatment options? Will they still work? Will they not work? Will vaccines just continue to work or not work? Will it increase disease severity and illness, mortality, etc.? Those are the considerations. That is why gene sequencing is an important tool of disease surveillance. And WHO recommends 5% of the sample should be sent for gene sequencing. Karnataka had sent 139 samples for gene sequencing. I'm not aware of other states, so I'm not just singling out Karnataka. I just read a news on Karnataka. That is why I'm aware that Karnataka had sent 139 samples. Karnataka has a population around 6.5 crores or 65 million for those, roughly around that figure. It is the same figure which the UK has. The UK also has around 65 million people or 6.5 crore people. So compare the population of Karnataka and UK are comparable. So I just thought that let us check out what about gene sequencing. So UK had completed 1 million gene sequencing. Just amazing, 1 million gene sequencing. So of course they will be more on top of information in terms of what kind of coronavirus is circulating in the population and what it means for the public health impact. Similarly, if we're looking at African gene sequencing data, there were 5,000 plus gene sequencing being done in April 2021. And by October, November, about I think 24,000 gene sequencing were done, and maybe more. I'm not very well. I could not find more data on that, but definitely South Africa seems to have a better gene sequencing competence. But maybe other countries may need to do more on that. But that is not my point here, singling out countries. My point here is that it is so important to scale up COVID testing along with gene sequencing data, so that countries, governments, public health officials, experts, scientists, etc., they are really on top of information on the kind of virus that is circulating in the population, so that they can tweak the prevention programs, they can tweak the diagnostics, they can tweak the treatment and care program, and timely manner, and we are not caught off guard with huge surge in hospitalization or infections, new infections, or the ventilation need, etc., or death rates, and it's totally out of control. Things go out of control. We really need to avoid that, and disease surveillance is one of the tools to do that. While on other hand, we are trying to do all what's possible to scale up vaccines equitably to fight COVID-19. And do other things like wear a mask, maintain physical distancing, maintain hygiene, etc., and do all the COVID protocols which are in evidence-backed and applicable in your place and context. So stay safe, friends, and let us hope gene sequencing becomes more of a norm than an exception. With these words, I will end today's CNS Viewpoint, and I will be back again tomorrow 5 p.m. with our thoughts and views and perspectives on something that made us think. Bye-bye. Stay safe.